Not you, Mel.
For once.
It's me, not you.
Check, 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 check. 500 now, 5 into 5 and 5 and 6. It'll just, yes, it works.
Commissioner Mason,
Here.
Commissioner Mapes,
Here.
Commissioner Turnbull,
Present.
Commissioner Van Alstine,
Here.
Commissioner Hankins,
Here.
Commissioner Aaron,
Here.
Commissioner Levanway. Here. Commissioner Chamberlain.
Here. All right. Would anyone like to add or remove any agenda items? Hearing none. Move to review and approve the meeting minutes from March 5th of 2024. Would anyone like to make a motion?
I'll make that motion.
I'll support it.
Moved and seconded. Any further discussion on our March 5th meeting minutes? All right, can we have roll call, please?
Commissioner Turnbull,
Yes.
Commissioner Hankins,
Yes.
Commissioner Levanway. Yes. Commissioner Mason,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Mapes,
Yes.
Commissioner Chamberlain.
Yes.
Motion passed.
All right, ladies and gentlemen, that moves us to public comment. We would ask that you step to the podium, state your name and where you reside. And on a side note, commissioners, please make sure that your mics are up close enough so that everybody can hear us. You'll have 3 minutes to address the board. I will give you a friendly warning at 30 seconds. There's a trap door at 3 minutes and I'm going to push. Sorry, Mary.
If anyone is not current, that you encourage them to be caught up and brought up to date.
Okay.
Do I need to repeat that or are we okay?
Are we good for the record? Okay. No, you don't need to repeat it.
Thank
Thank
you.
you. Would anyone else like to address the board? Hearing none, public comment is now closed. Which leads us to a highlight of the day, our financial audit report. Shannon?
You're really selling it there. Okay. I would like to welcome Trina Oach with DGN. She has our final audit report today. This is the hard copy, fresh off the press that we distributed to everybody. And we will have electronic copies available after the meeting today as well. We'll send out to everybody. So with that, I'm going to turn the mic over to Trina and she's going to present the audit.
Good morning.
Good morning. Good morning, everybody. So you have 3 items in front of you. The first is the bound audit report, which is the big report, and that is where we will start. These are the audited financial statements of the Health Department of Northwest Michigan for September 30th, 2023. And if you turn to the first page right after the index, it's page number 2 on the financial statements. This is the independent auditor's report. So the financial statements are the responsibility of management of the health department, and then our responsibility as auditors is to issue an opinion on them. And we did issue a clean or an unmodified opinion. So that's the highest level of assurance that we can provide you as auditors. And this is also what's called a single audit or a federal grant audit. So you'll see in the letter, it talks about government auditing standards, and the audit was performed in accordance with those auditing standards. And we did not have any, or we did not find any material noncompliance with your federal grant awards during the year. There was one minor immaterial noncompliance for a very minor disallowed cost, and that was corrected at the time of the audit. From there, we will turn back a couple of pages to the management's discussion and analysis. This is a summary of the financial results for the year. And I always encourage board members to, if you just want a nice summary, to read through the management's discussion and analysis. It gives all the highlights. On the second page of that, third page, page 8. It gives a summary of the total net position. So the total assets at September 30th were 13.4 million. Of those assets, about $3 million are in capital assets, which is equipment, buildings, vehicles, items that are not actually liquid. They're in the form of capital assets. There was some deferred outflows of $624,000, and that's related to the pension plan. For liabilities, those were $9.1 million. The long-term portion that will be paid in greater than a year of $4.7 million includes long-term leases and the long-term pension liability. So that pension liability is an estimate provided by MERS, and that's updated annually. And so the total net position for the year at September 30th was $4.9 million. Of that, $431,000 is the net amount in capital assets. So that's the capital assets less the related leases on those leases payable. And the unrestricted net position was $4.5 million. And that is within the policy range of the health department requires it to be. On the bottom of the page is the revenues and expenses. So total revenues for the year were $34.1 million. Total expenses were $33.1 million. And so for the year, there was a net income of $1,098,000. From there, we're going to turn it back all the way to page 35, which is the budgetary comparison schedule. And this shows for the year ended September 30th, the health department budgeted revenues of $34,054,000. Actual revenues came in at $34,152,000. So your revenues came in better than you budgeted by about $100,000. And then expenditures were budgeted at $33.9 million. Actual was $32.8 million. And so expenses were better than budget by $1,087,000 for the year. So overall for the year, there was a net increase in your fund balance of $1.3 million. When you adopted your final budget, you anticipated that that would be $134,000. So overall, you came in better than budget by $1.2 million. There was one line item here, the capital outlay, that was slightly over budget in expenses, but expenses in total were under budgeted expenses. From there, we'll go ahead and take a look at the graphs, which give a nice summary of the operating results. So the first page of the graph is the ratio of the fund balance to the fund expenditures and the 5-year trend here. So at September 30th, 2023, the total fund balance was $5.8 million, and that is 17.6% of your expenditures for the year. So you'll see that that did increase over time. So as a benchmark in general, like the gold standard or the great recommendation is to try to build that to about 30% of expenses. And that allows for timing so that you have some reserves in the bank for when you're waiting for your accounts receivable to be collected. Under the next page is revenue trends. So you'll see a couple of different line items here. The red line item is charges for services and is by far the highest revenue for the health department. That was at $18.1 million for September 30th, 2023. The blue line is a state and federal, and that was at $10.6 million. So that did slightly decrease from last year. The green line is local grants, and those were at $4.1 million. And then the local county contributions is the bottom purple line there, which was at $1.1 million. And then the next page is that same information for expenditures. So the blue line is personnel services. Those were up to $15.7 million for the year ended September 30th, 2023. The green line is contractual expenses, and those were $10.6 million. The red line is supplies, and those were $3 million, very consistent with last year. And then the pink line is the other expenses, which is really temporary staffing, IT, and advertising. And that was $1.9 million for the year. And then the remaining items, space cost, capital outlay, travel and communications were all the smaller expenses on that graph there. The next page is a comparison of revenues to expenses for the year. Again, it does have 5-year trend information here. So for 2023, total revenues were $34.1 million. That's the blue line. And total expenses were $32.8 million. So revenues were over expenditures for the year ended September 30th, 2023. In 2022, revenue was 31.1 million and expenses were 31.3 million. So they were much closer to being the same amount last year. And the next page is revenues compared to the budget. So the blue line here is the 2022 actual results. The red line is the 2023 actual results. And the yellow line is the current year budget. So you'll see overall state and federal grants were slightly lower than budgeted for the year and lower than last year. The local appropriations were all very consistent with last year and with the budgets. The charges for services were up this year. Those were about $900,000 over budget for the year. And then the other revenues were also very consistent between the years and with the budget. Then the expenditures, again, the largest expenses here are the personnel services and the contractual. So the personnel services were about $300,000 under the budget, but 2023 did have an increase in those expenses over 2022. Supplies were fairly consistent. Contractual came in right at the budget as well for 2023. Most of the other expenses are all fairly minor. As I mentioned, capital outlay was slightly over budget, but it was overall expenditures were within the budget for the year. So those are the financial results. Are there any questions on that before I go over the audit related communication letter? Okay. There's a separate audit related communication letter, which is items that the standards require us to communicate to those charged with governance after we complete an audit. So the first page talks about compliance and internal controls. As I've already said, we did not have any recommendations or findings, non-compliance with laws and regulations or in your policies and procedures or internal controls for the year. In the middle of the second page, there's a couple of just general recommendations. The first is that the internal service fund should be a separate self-balancing fund. Right now, it's included in the regular operating fund of the health department, and we split it out for the financial statements. So that's really just a sort of a bookkeeping item to create a separate fund within the software to account for that. And then budget amendments, this is just letting you know that there was that one line item capital outlay that was in excess of the budget. And so the audit does report that in a footnote that one item was over budget. That's required by the auditing standards. Under qualitative aspects of accounting practices, the health department did adopt a new standard this year, GASB 96 for subscription-based information technology arrangements. So this is really multi-year information technology arrangements where the health department is obligated to make a payment and it's non-cancelable. So the finance department did do a deep dive of all of those agreements and we did not find any that had to be recorded under the standard. We found everything was recorded in the proper period in the financial statements. On page 3, this lists several items that include inherent estimates in the financial statements. So the allocation of costs is an estimate. The state grant revenues is an estimate. Collection of receivables is an estimate based on, billings to third parties and contractual allowances. Depreciation, the obligation for paid time off, the net pension liability, and the operating lease liability. And so all of those we evaluated and we found that those estimates were calculated reasonably in accordance with the standards. On page 4, as far as significant disclosures, we mentioned the accumulated accrued benefits, the lease liabilities, the pension plan, and the related pension disclosures. We had no difficulties encountered in performing the audits. Under corrected and uncorrected misstatements, we had no audit adjustments, which is a huge achievement. I see someone shaking their head. It's very, very rare for us to have no audit adjustments. So that is really a testament to your finance department and all the staff being very diligent to make sure everything is correct before the audit starts.
Shannon's really, really mean, so I'm not surprised by that.
There were some lease liabilities for some printers that were minor. They weren't recorded under the lease standard and they're not required to be because they're so small. We had no disagreements with management. On page 5, we had no consultations with other accountants. And then finally, on the bottom of the page is some new accounting standards that are coming out. So in fiscal year, September 30th, 2024, there's this new standard for accounting changes and error correction, and it just gives guidance on when you make an accounting change or if you have to correct an error in a period after it occurred, what you need to do to present that on your financial statement. So that's really just informational. On page 6, there's a new standard for compensated absences, so accrued paid time off. This is effective for September 30th, 2025. And the main change in this standard is now paid time off should be accrued if it's more likely than not that it will be paid out in paid time off or when people leave. Previously, it had to be accrued if it would be paid out when somebody left. So that it might result in an increase in what's reported for paid time off under this standard. So this is effective for fiscal year 2025. And then under other matters, we did look at the required supplementary information, including the budgetary comparison schedule and the MERS trend information, and also the schedule of expenditures of federal awards. And we found that those were all supported by the books and records of the health department. With that, are there any questions about the letter?
Any questions regarding our audit?
I would just like to say one thing. Being the chair of the finance committee, the people that I have worked with have been so professional and so transparent that it's been absolutely wonderful to work with them. And I just want to congratulate them on, because this audit has been really wonderful. It's great. Thank you.
Thank you, Shannon. Great job.
I'd like to echo Commissioner Levanley's statements. You know, I haven't been here long, but I've been very impressed.
We need a motion to accept the audit.
Sure.
I'll make that motion to accept the audit.
I'll second it.
Moved and seconded. Any further discussion? Comments, concerns? Hearing none, can we have a roll call, please, ma'am?
Commissioner Levanway,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Hinkins,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Mapes,
Yes.
Commissioner Mason,
Yes.
Commissioner Turnbull.
Yes.
Motion passed.
All right, thank you. Thank you, ma'am. Appreciate you being here today.
Yes, thank you.
That moves us to staff reports. Mr. Thorell.
Good morning.
Morning.
Well, it's kind of funny, before the meeting, Shannon and I were debating whether we needed to have a motion prepared to accept the audit, and we looked at last year's and we didn't. So, oh, okay. No worries. So my report focuses on a couple different things. The first thing is the Michigan Association of Local Public Health Day at the Capitol event, which is coming up actually next week. And I just wanted to let the board know, you know, what we were planning and what we were doing for that. So we always, as the Northern Michigan Public Health Alliance, we always kind of pool our resources and have our public information officers and whatnot work on a packet of information and pick some priorities that we want to talk to legislators about. Not that that is, you know, exclusive to what we're going to talk about, but it just helps us guide and gives us some collective impact for our northern region, basically northern lower Michigan. So if you look, the alliance consists of 31 counties. We serve 841,000, approximately 841,000 people and cover 16,669 square miles, which is a pretty significant area, and a pretty significant population. So like it just makes sense pulling our resources together, our voice together, for that effort, because I think, what I've heard in Lansing is anything north of 46, the voices get dimmed a little bit. So, this kind of gives us a louder voice, so to speak. So, so at the day of the Capitol, basically we are making appointments to meet with local representatives. We have appointments set up with Senator Hoytinga, Representative Kofia, Representative Borton. We're working on confirming our appointment with Senator DeMoose. Representative Roth, we're meeting with, and then also working on setting up a meeting with Representative Prisky. So we've got our bases covered there. And this is going to be happening on Wednesday, April 10th. We'll be going to a couple different events that day. In the morning, it'll be the county health rankings breakfast. And then during lunch, we'll be in between that time and the lunch presentation, we'll be meeting with representatives and legislators, senators and representatives, I should say. And then we will be attending the Hometown Health Hero presentation, which will be around noon, which is in that Heritage Hall, which is basically outside the legislature. So it's a good day for public health to get down there and kind of get in front of these legislators to, make our voices heard and just tell them what's important to us. So getting to the main points that we're going to be talking about. One of them is advocating for a unified Michigan sanitary code to safeguard our clean water, groundwater, and surface water for residents. Basically, we've talked about this a lot in this meeting and outside of this meeting. I've talked about it and have been working with legislators on making these bills a little bit more palatable. We're still not there on the 5-year frequency component of the bills. That is still in there. We're waiting for a new draft. But as of right now, we are telling legislators we cannot support that, right? But we do support a unified code that has minimum standards, minimum design standards, and minimum standards for siting criteria for septic systems, because it's fragmented across the state, and there's some areas that they allow septic systems to actually go into groundwater, which is a bad thing. Okay, here we are well situated to not have any impacts really from that change, because we have a very strong sanitary code. And I'm repeating myself. We've talked about this before, but it's worth repeating. And I think, we'll be by supporting that aspect of the bills, that's something we can all wrap our heads around. We're also advocating for sustainable funding for the Shire Community Health and Innovation Region to support the work that we're doing to lessen barriers to healthy living, basically. The word is, at the state level, and what we're hearing in the public health circles is social determinants of health. What we're trying to do and working on, and what we have been working on for several years, is trying to eliminate those social determinants of health, to make it easier for people to access healthcare, mental health services, and just nutrition, the whole gamut. So those are the things that that we've selected to basically talk to legislators about, to support that work, support community health workers that we have working within that 31 county region by providing funding for that, sustainable funding. And then we've also want to talk to legislators about the funding issue for hearing and vision programs. This has been a long time program in the state. I believe this year is the 75th anniversary of the hearing and vision programs, which are have been, I think, out of any public health program, which we have a lot of good ones, this one has a huge return on investment, because screening these kids when they're really young in kindergarten and whatnot for hearing and vision problems it impacts their whole lives, you know, in school, out of school. And if we can catch those problems early, get them addressed, I mean, you know, you have kids that go from not getting good grades or good marks to once they get things like that addressed, the hearing and vision component, they're, you know, all A students, right? And so it's not only good for their, you know, their health throughout the years, but just their mental health and just being able to learn and be productive members of society going forward. So that's what I have to, you know, share on that aspect of things. Do I have any questions before I move on to the next?
I would like to say that vision is key. My youngest daughter was a terrible reader. Kindergarten wasn't meeting. She got the screening done. You guys provided. She failed. We took her in. She needed glasses. Now she is back up to where she's supposed to be. So it does work. And
That's
we-
great to hear.
Yeah. So I personally know what that's like. Just wanted to share that.
Thank you.
Anything else for Dan on,
Yeah,
on
I-
that? Mr. Mason?
Dan, thanks for taking a stand, and evidently perhaps most of Northern Michigan is joining you with that.
Commissioner Mason, would you mind moving your mic closer?
Oh, make sure you're on.
Got it right.
Is it on?
Can you hear me
No.
with it? It's on now?
I think so. You just got to get it kind of close to your mouth. but-
Okay. So you've spoken to the fact that a group of you have banded together concerning the septics issue. Do you think, you said you've tried to encourage them to move away from some of their stringent regulations. Do you think you can gain any ground with them? Are they listening, or are they, is there any hope in this? Or, you know, they've only got 3 years to make the regulations even more stringent. So what do you do to?
Right. I think they are listening. You know, when this whole thing started, I think these bills initially came out a year ago, and gradually over time where they, you know, didn't look like they were listening. Now we've been invited to meetings. We've, you know, sat down at a table with the bill sponsors and telling them our concerns. And there have been changes made in the substitute bills. The one change that hasn't happened is moving off of this 5-year frequency requirement. And we keep telling them that, you know, we have many concerns over that. I don't know what to expect. I mean, they are well aware, and we're going to keep on beating the drum as far as telling them, you know, this is a real issue for not only for health departments to implement. It's really, it's an issue with implementing it. In a perfect world where, you know, we have all the staff and resources that we need, our citizens of our communities have all the money they need, right? In a perfect world, it would be great, right? To have every septic system looked at, you know, is it up to snuff? Have it cited properly? Everybody's happy. Well, we know that, you know, that's not the case. I mean, there's significant, you know, the workforce issues for health departments, and then the cost issues for communities to comply with this when you're just painting, you know, with a broad brush, right? I mean, it needs to be more, I guess, surgical in that aspect. I guess is the way I would describe it. You know, what we keep on saying is that, you know, trigger-based inspections work. Time of transfer, or like if somebody gets a building permit, you know, things of that nature, change of use, those work, they've proven to work. And that's, I mean, that's what we keep on telling them. You know, we can't control exactly what they're going to put out in the legislature, but that's our message. That's what we're going to keep on saying. And hopefully we're gaining a little bit of ground. There have been changes made that make the bills, I'll just say, less worse, for lack of a better term. But I think we are making a little bit of headway. And all I can say is I believe that the real estate lobby is really strong. And I think they're really the ones that are opposing having a time of transfer, type program in the state. So, long-winded answer to your question, but hopefully that answers it.
Dan, have you chatted with other health departments like in southern Michigan? Where they have a little more people and what their view is on this bill?
Yeah, so I'm on a kind of in a informal group that's been meeting with the legislators that are the bill sponsors. And the health officer from Macomb County, who used to be the EH director, the environmental health director from Oakland County, and the environmental health director from St. Clair County are all in our group here. So I'm the lone voice from northern Michigan. We all agree on the, basically this 5-year frequency thing, that it's just, going to be bad for everybody. It's not something that can be implemented. It's not feasible. But they do, some of those counties, and even like St. Clair County, they're one of the ones that, their code is, because they have terrible soil and high groundwater, that systems can go into the groundwater there. And they recognize that, it needs to change, right? Because, some of the reasons why we're seeing some of these efforts at the state level is because there's been studies done by Michigan State University, for one, looking at water quality in a lot of the waterways, and most of them are in lower Michigan, where they're seeing, human waste in these waterways, in the rivers and lakes and whatnot, much more so than we've seen in northern Michigan. I mean, we're blessed with really clean, pristine waters here, relatively speaking. I mean, we have our blips here and there. I mean, we we have communities that live along the water, so there's going to be issues, but for the most part, we are very, blessed to have the pristine waters that we do. And I will attribute that to, decades of having strong sanitary codes and just, basically doing the right thing. Now, of course, we're blessed with good sandy soil too. So in those other areas of the state where they don't have those situations, it's been more of an economic growth type argument, right? Building houses and trying to deal with what they have down there. Now, in today's world, we have technology that, you can use to make those systems work a little bit better in those type of situations. So I guess, again, long-winded answer to your question, but those other areas, I mean, they recognize that a unified, stronger statewide code as far as like the design of systems and minimum requirements for systems would be good, as long as it's practical and, you can meet it, right? But we're all unified as far as this 5-year frequency type evaluation program. So.
Go ahead. Question. How does your informal group's agreement on the issues, how does it match up at all with Michigan Association of Counties efforts?
So in this stakeholders group, there is representative from MAC.
Dina Bosworth, maybe?
I'm trying to remember. No, it's I can't remember the person's name, but she is there representing MAC, and they are pretty much opposed to this frequency type evaluation program as well, and have made that known. They don't know a lot of the technical components of how septic systems work.
I'm just glad they're in the room with you, because that's our lobby. The
Yes.
real estate may have a lobby, but counties have a lobby called the Michigan Association of Counties. All 83 counties are members, and that's our legislative lobby in Lansing. They bring our issues. We bring our issues to the various committees. In the committees, we create platforms, and then those platforms are given out to our legislators to say what we're in favor of and what we're not in favor of. So.
Yeah, and I'll say there's others there, Michigan Municipal League, Michigan Township Association, SIMCOG, Southeast Michigan Council of Governments, and we're all, pretty much aligned regarding, what the issues are and our,
That'll help.
thoughts on that. So.
Anything else for Dan?
Okay, I'll just move on to the next then. In March, a couple weeks in March, we had our local public health accreditation. And just to give you a little background on that, the accreditation program is in place to assure and enhance the quality of local public health in Michigan. We've been doing this since I think it was first done in the late 1990s, and dating myself, but I've been around, since the first one. So basically on a 3-year cycle, the state, MDHHS, Eagle and MDARD come and look at our programs. And they're mostly the essential local public health services programs, the 8 programs that we're, absolutely mandated to do by the public health code. And what some of these, this kind of lines up with our 10 essential public health services and the assurance side of things where, we're looking at continuous quality improvement, uniform standards that define public health. And this is a process which the state can ensure local capacity and address, core functions or deficiencies with those core functions, and provide a mechanism for accountability because, this accreditation program, it's important because it's tied to our funding. So if we did really horribly on our accreditation and we did not fix things, then we would not be funded by those entities, and the state would take over those programs and charge back to the counties a significant amount of money for overhead and operating those programs. So it's really important process. And we just, completed this. They were here from March 11th to the 22nd. Normally it's a week, but it was spread over 2 weeks because of schedules. But overall, I can say that, we're not going to receive the report until I think 30 days after they leave, but all the program indicators were met. I mean, in the exit interviews, we heard consistent messaging of just how impressed they were with our staff and, how well prepared and how thorough and how exceptional the work is that we are doing. So I just want to, let you know that what they are saying about our staff, which is what I already knew, that we have exceptional staff. And I'm just really proud of them for all the work that they've done. And there's a lot of preparation that goes into this. Last month you approved the plan of organization. And there's just a lot of preparation into preparing for each one of these sections of accreditation. So just to give you a little bit more, information about exactly what they were looking at. The sections are local health department powers and duties, which is more or less the administration and looking at like the things that are required by the public health code regarding capacity to carry out disease investigation or educating the public about things that are going on in the community with certain communicable diseases. And there's about 7 indicators that go along with that, including nutrition and other things. So our food service program in environmental health, our on-site wastewater management program in environmental health. And then they also look at general communicable disease control, our immunization programs, HIV and STDs or STIs, family planning program, and children's special health care services. So that's basically the main programs that they're looking at. They also came in, evaluated hearing and vision, which is part of something that's even looked at even more frequently, which is some of our other programs, like I put in here in the last paragraph, is we're not just on a 3-year cycle, but sometimes they come in 1 or 2 year cycles for specific programs outside of accreditation. So again, just want to really, give a shout out to our staff for all the great work that they do and continue to do. And, I would say, what I consistently heard, because I sat in every one of the exit interviews, is that us, Health Department Northwest Michigan, compared to other health departments, is we stand out. So it's really great. So thank you. I do something that's not in your report. Well, first of all, I guess, do you have any questions about accreditation?
Do they check on dental?
They do not. No, it's outside of, because not every health
Oh.
department in the state does dental services like we do. So we don't have an accreditation for dental.
Do you foresee that changing throughout the state? I mean, you just talked about the hearing in the eyes, but not dental.
Well,
which is
I,
pretty
I'll take that
interesting.
back. So we do have a newer program called the Kindergarten Oral Health Assessment Program, which that will be included with the hearing and vision part of accreditation. I'm positive that will happen. But other than that, I was thinking about like Dental Clinics North, and we don't have an accreditation for that because that's not something that every health department in the state does.
I guess that's what I brought to my attention was you're doing such a great job with dental. Wonder who decides this accreditation of what's checked and not checked?
Well, it's tied to, so it's really,
Is it a
be-
committee that
it's a
decides
committee,
questions?
right? It's a committee, between Department of Health and Human Services, Eagle and MDARD, because in what it's tied to are those 8, essential local public health services, which are specifically mandated in the public health code by name, by say you have to do this program. So that's why. So health departments across the state do varied other, other
Things.
programs, other things. And but those are not part of the regular accreditation. And
So-
like I said, some of the other things that we do, like WIC, for instance, that has its own evaluation.
Mm.
I believe that's yearly. Is that yearly? Every 18 months. Yeah. So there are some other programs that do get evaluated, but it's just not part of, local public health accreditation. Yeah.
So do you know the stats on how many do the dental in the state?
That might be a better question for Holly, but I know we have Dental Clinics North are the big ones, and then MCDC, My Community Dental Clinics, which are more mid Michigan and southern Michigan.
And then I think there's only 2 or 3 other health departments that have like the setup like we do.
So we really are special.
We are.
Out of 45. Really? Okay, thank you.
It's good to be a leader.
Yes. You mentioned-
Commissioner Mason, would you mind?
Oh, yeah.
Sorry, we
Is
get,
it on?
it's for the benefit of the people
Yeah, you're on.
watching at home. So if you can, but you just have to put your mouth about 2 inches from it and you're good.
I'll swallow it.
That's the general advice. You're supposed to eat the mic. Is the phrase, eat the mic.
Thank
You have your mouth that close that you could go, ah.
Okay, so I sit on the soil district board, and their MDARD is being, I don't know how it's married to the state entirely, but evidently the MDARD employees that attended the soil districts and so on, there's some mid-30s numbers perhaps they're going to be reduced. The state is taking that program over entirely. They're going to reduce the numbers to about half. And then they will be direct state employees. And that's by October, the employees that are present, I'm not certain any of them will keep their jobs. I believe that's going to be all state staff taking over MDARD. And
Is that conservation districts you're talking about?
Yes.
Okay.
yes. And so then of your 10 essential points, I've noticed when you go down, when I think of things like this, and we think of the layers of the onion that sometimes we wish we could peel back. And so you've got an accreditation going through Eagle. Eagle hits me more than any of them. And when you go to the bottom of your, let's see, you're down into the green and create, champion, implement policy, plans, and laws. And then you move to the darker green beside it. And so I'd single out something like create laws, and of course, legal It's pretty hard to fight the legal when we create the laws because the state controls the taxes that you know, take care of litigation, so on. Just commenting, I know, I picked that out of we're creating laws and it's too bad that that's where your department has to come to with accreditation. I just see it as, is that the way to the future? You do well with other issues within the department. But do we have to create more and more laws and regulations? Thank you.
Well, really the only, I mean, the law that we specifically create or as the Board of Health, which is then approved by the boards of commissioners of our respective 4 counties would be our sanitary code.
Okay.
Yeah. All the other, you know, some of the other laws that we follow are state laws. For instance, like the food code, and the food law, well, we follow that. That is a statewide law, but each health department has its individual sanitary codes. Typically, we can have other regulations too. And I think at one time, before the statewide smoking regulations were in place, we had our own smoking law here in Health Department of Northwest Michigan. And this predated the statewide law by a few years.
That's one thing they did I like.
Yeah. Well, that's good.
Anybody have anything else for Mr. Thorell?
Mr. Chairman, I just wanted to, I did not include it in the report, but just to give a little bit of an update regarding the lawsuits that we have ongoing. On March 12th, there was a hearing in Emmett County regarding the concerned parents of Emmett County case regarding the mask mandate from 2021. That case was, the judge ruled from the bench, dismissed the case as moot. So that is what I know right now from March 12th. Coming up next week, actually on April 9th, there's a hearing in Otsego County that has to do with the lawsuit regarding the Iron Pig. And I will be at that hearing. It's, I think, 1:30 in the afternoon at the Otsego County Courthouse with our attorney, Matt Cross.
Thank you. All right. Do we have any questions for any of our, regarding the written report submitted to any of our directors?
Yes.
Mr. Mason?
Well, I think I'll save that for the vote.
Okay. Anyone else have any questions for any of our directors who are present? Hearing none, we'll move to committee reports. Ms. Levanway.
For the Personnel and Finance Committee, we went over the bills for February and they need approval, so I'll make a motion. The Finance Committee met to review the bills and employee expenses and would like to make a motion for the full board to approve the February 2024 bills in the amount of $667,121.33 and the February 2024 employee expenses of $15,954.36.
Second.
Been moved and seconded. Any further discussion? Mel, can we have roll call, please?
Commissioner Levanway,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
Yes.
Commissioner Aaron's,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner Mason,
Yes.
Commissioner Hinkins.
Yes.
Motion passed.
Thank you. Program and Evaluation Committee, Mr. Thorell again.
Commissioner Chamberlain, did you want to start off with just synopsis of the meeting, then we can go
Yeah,
on from there?
I just start off that we had a meeting on March 5th after our last meeting, health department meeting, and we discussed bylaws, looking over them, to make some little changes before we bring it to the board, for you guys to look at. And then we went over this Michigan Office of Highway Safety Planning seatbelt grant. A lot of info. I'm still, it's there's a lot of stuff. So Dan could probably explain it better for us.
I didn't mean to cut you out, but his name was here on the
That's
agenda,
okay.
so
Dan would be.
Yeah,
first.
sorry about
Yes.
that.
that's right.
Yeah, and at the committee level, I think it was unanimous to move this in the affirmative to the full board. So just looking over the grant application review form, this grant application is called the Otsego County Teens Driving Safely Initiative. And really, this is something that through RISE, Otsego Substance Free Coalition Initiative, this would be, this program, if it is successful, would be administered by RISE. And then basically through a program that would enhance road safety and seatbelt usage amongst Otsego County teens, and then also looking at distracted driving and impaired driving as part of that programming, which it fits well with what RISE already does in the prevention side of things. So basically the reason that this came about is the Office of Highway Safety Planning reached out to us to let us know that seatbelt usage in Otsego County was lower than 90%. I believe was 86.2%. And because of that, they encouraged us to apply for a grant if we had something in mind to propose to try to affect that and to increase that percentage. And when we were looking at the data, basically teens comprise 6.7% of the driving population in Otsego County, but are involved in 18.1% of the distracted driving crashes. And just given that coupled with the seatbelt usage for the broader community, it is a good preventative grant that would help us basically, hopefully prevent injuries, save lives in Otsego County by teaching the new drivers, teens. It's no secret that, teenage drivers are, I can tell you this from firsthand experience because I have teenage drivers and how much I pay in insurance. And there's a reason behind that. They are the most, the probability of them getting into an accident or having issues is much higher than the rest of us that are experienced. And, this goes along again with the programming about substance use prevention, prevention of the use of alcohol and things of that nature. And so by applying for this grant, which, after the committee, moved this forward, we did submit the application because it was due on March 15th. We were hopeful that we were able to receive this grant, and I think it will be a good for the residents of Otsego County and fit well with our current programming. I can tell you that we did get the Undersheriff Matt Mullador issued a letter of support for this grant and is the chair of the RISE Coalition. So he's very supportive and thinks it would, be a great fit for RISE and, currently what they're doing in the prevention side of things.
Okay, thank you, Dan. That moves us to unfinished business. We have none listed.
Chairman, I
Oh, I'm
think
sorry.
we need a motion, I think, to move that grant forward, I believe.
Yes, we do. Thank you.
And I have a proposed motion that I handed out to Mr. Chairman and Commissioner Chamberlain, I believe.
You want to make the motion?
Sure. I will make the motion to approve the Health Department grant application for the Otsego County Teen Driving Safety Initiative to the Michigan Office of Highway Safety Planning for the fiscal year 2025.
Second.
Been moved and seconded. Any further discussion?
Mr. Chair,
Sir.
I have a question for Dan. Is Mrs. Templeton here, Dan?
No, Mrs. Templeton is not here.
She's not. And my question is to you then. Do you know, will they be implementing their program within the school system?
Well, it does fit, it would be administered by RISE. So yes, it would be within the school system, working with the groups of teens that they already work with, in that RISE coalition.
Do you know, will they be discussing this or have they discussed this with the Otsego County School Board? Whether or not to see whether or not this is something that the um education system wants?
I don't know that they specifically talk to the school board to get approval, or if that's, I mean, the school board is aware of and welcomes RISE in the school district and in the schools that with the students that they work with already. And I believe there's some school members that are part of the school board members that may be part of the coalition. I don't know the exact representation, but I know that it's the coalition has law enforcement, school officials, and other interested parties that are on that coalition. So I know that they're aware of this because Ellen, when we were looking at this and prior to the bringing this grant to the Program and Evaluation Committee, she reached out to Matt Mullidor, the board chair, to discuss this. Is this a good idea? Does this fit with our coalition? And, they agreed that it did. But I don't know that they specifically went to the school board to talk about it. And probably not if I had to guess, but I don't know that for sure.
Okay, and my second question is, the grant has already been applied for, right? I think
Correct.
It said the deadline was March 15th or so.
Right. So because of the timing and everything and the way we have in our grant policy is that, if we get the go ahead from the committee, we apply. If the board has an issue with it, then, we just don't accept it if the board did have an issue. So it's more of a timing thing because of when the grant was due.
Okay, so just based on those two things, as a commissioner for Otsego County, I reached out to members of the school board and talked to them about it, and they were unaware of it. I'd like to see greater communication between Mrs. Templeton, Under Sheriff Mullendorf, and the school board. Something easy would be for them to go directly to the school board meetings and present it, or just during public comments, be like, hey, here's something we're working on. What do you guys think? Because I asked a follow-on question about it was with the Tobacco-Free Michigan grant that we approved a few months ago. They've not heard of anything of any of the programs that have been done, and there has not been any communication between RISE and the school board. So I asked them what their opinion was on it, and the individual I spoke to was opposed to it, stating not only is there no communication, so they don't have the kind of overstepping the bound, the reach of RISE and doing it, but also they do have, I was informed that they do have programs within Gaylord Public Schools, that the state police go in and are working with the students, and not just with the students. The important thing is, if we move forward with this, what I would like to see RISE do is not just working with the students, but with the parents. A lot of this stuff is, the fault of the parents. Making sure their kids are wearing their seatbelts, and I understand if you're over 16 in the back seat stuff, but we can still instruct the parents and letting the parents know that it's important that the kids wear their seatbelts. So moving forward, I would like to see that if we move forward, but I'm opposed to it for the two reasons. One, that it's been applied for and we didn't have, we could have held a special program evaluation committee meeting if Mr. Chamberlain would have called it. I would have been there. We could have done this, or it could have been a little bit more forward planning on their part to see, so they don't have to apply for it. And like your guys, I believe it was the mindfulness grant that you guys applied for back before I became on the board, where it was applied for, everything was good to go, and then the board voted no. It looked, it doesn't look good. I don't want to see that happen again, unfortunately. But so a little more forward leaning. But those are the two main reasons. So the one main reason I'm opposed to this is that the school board not being informed or having any communication with RISE, and that there already are programs in place. The two that they mentioned specifically was that we all know the click it or ticket. I mean, I remember that one. But also and I was just talking to the chairman about it earlier, but the Safe Kids program, that not only is it the within our schools being done, but the fire departments, the police officers are being instructed on how to make sure that booster seats and car seats are applicable. So parents come and they get these things inspected, but not only is it inspected, but again, it's the parental involvement. The inspectors are teaching the parents, all right, this is the proper way of doing this. This is why, kids are forward facing. This is why they're backward facing, why under, I believe it's 80 pounds, they have to be in a booster seat. So I see a lot of potential there. So there are programs in place. If Otsego County, we have problems with the kids not wearing their seatbelts, then again, it makes me kind of question our authority and the health department. Is it the health department's place to step in there and tell the kids to wear their seatbelts after we lost so much credibility with the mask issue? And won't get into that, but or is it more important? Would it be better to use, for the police department, for our local sheriff, our chief, or, our city police to go in there and speak with the kids, seeing the badge, using the authority of the judicial, serve and protect, where their main tenet is providing public safety. So I just don't know if that's, the direction that we want to go with this board. So there were a few issues that I see that we could clear up. I mean, certainly for future grants, that when RISE comes back to us asking for other grants going forward, I mean, I'd like to see one lean forward in the saddle a little bit more and see it. That way we could discuss it before they just apply for it. I would like to see there be more communication, especially if it's just for one county. I mean, this is Otsego County's RISE. It's not, doesn't have an impact on the other 3 counties. So I don't know how fair that is that we have to pull the other counties into it without them having some effects on their end. But that's the other big one. So communication is the big one for me. That's all I have, Mr. Chair.
Thank you, Mr. Chamberlain.
I would like to go on record. We did try having an early meeting. I asked and called and you guys canceled that. We could have had time. We just need to put that out there. And I tried getting a meeting earlier, special meeting.
Well, can I say one thing about that? I mean, we did meet on March 5th. And the way that our grant policy is written is that, if the committee, program and evaluation committee moves it forward, then we apply. And that's what we did. Basically most of the same information was debated and looked at in that March 5th meeting. And that's just kind of the mechanism with the timing with grants. I mean, that's something that we pointed out a long time ago that would be an issue. And that's kind of what we came up with as, okay, taking it to the committee. If the committee is okay with it, then we'll move forward and apply. Knowing that, we might not have a Board of Health meeting in that time frame because sometimes the turnaround times are just problematic. That's just the way it is. So, but we did discuss this and look at this, and it was moved forward by the committee on March 5th. And then as far as Commissioner Turnbull, the communication with the school board, I can certainly pass that along. I don't think that's a bad idea. The more communication, the better, right? So everybody is just in the loop and knows what's going on. And we will certainly take that into consideration and try to do a better job at communication. We can always, do a better job with communication for sure. So
Thank you.
I'll take that back and I appreciate that comment.
Mr. Chairman,
Mr. Mason.
will this be the duplication of what is already taught to students for seat belts in driver's training?
Well, a lot of kids aren't taking driver's training with the cost. It's amazing how much it's dropped.
How do they don't have to take driver's training to get a license?
So have, I don't know since you've had kids, but now
Oh,
that
mine went through driver's
it
training.
was through the school system. Now it's private. I mean, you're looking at paying $500 to $700 to send a kid to the first segment. I'm going through that right now.
Hmm.
That is why there's so many young kids not getting their license. And the state's actually getting smart. They're trying to change it to go back.
So you mean that someone's giving a private instruction, but wouldn't that be a part of the instructions? They have to be accredited for
If-
that, would they not?
If those kids are taking driver safety. A lot of kids aren't. They wait till they're 18, they take their little tests, their driving tests and get their license.
Commissioner
So they're
Mason,
not going through courses.
Oh, sorry, I didn't mean to interrupt.
So it's it's way different today.
I would say, absolutely in driver's training for the kids that are taking it. They certainly cover the safety aspects, seatbelt usage and impaired driving, distracted driving for sure. You know, is this a duplication? This is more of an effort to address an issue that has come up specifically in Otsego County based on the seatbelt usage rate, to try to turn that around. Where, you know, we think it'll be effective. We think RISE is a good platform to do that because they already have the coalition in place. They have it's student-led, adult guided. It's coming from their peers. And I think it's a good platform. It works with, is it perfect? Are we getting kids completely off, substance use? No, of course not. There's always going to be, people that are doing that, but are we making headway? Yes. And I think it's a good avenue, a good platform to make headway in this area. And certainly, I mean, it fits within the mission of the health department, prevention, whether it's, regarding communicable disease or substance use, injuries, morbidity, mortality. If we can prevent morbidity and mortality, that's definitely within our wheelhouse. And, I think we can do a good job at doing it.
And, teenagers, they don't listen the first time. So anytime you can reinforce messages, I mean, you got to keep constantly reinforce it till they get it in their heads sometimes. I mean, just the way they're built.
Okay, I'm going to call the question. We've had a motion and a second. Roll call, please.
Commissioner Aaron's,
Yes.
Commissioner Chamberlain,
Yes.
Commissioner LeBanway,
Yes.
Commissioner Van Alstine,
Yes.
Commissioner Mapes,
Yes.
Commissioner Turnbull,
No.
Commissioner Henkins,
Yes.
Commissioner Mason,
No.
motion passed.
Okay, thank you. That moves us to unfinished business. Again, we have none on our agenda. Moves us to new business. We have none on our agenda. That moves us to public comment. Ladies and gentlemen, again, if you want to address the board, we'd ask you to step to the podium, state your name and where you reside. You'll have 3 minutes to address the board. I'll give you a friendly warning at 30 seconds. Would anyone like to address the Board of Health?
You got to move the
Turn
button.
the-
I see the
forward.
green light's on. I think we're good. Hello, Scott Coger, Antrim County. Good discussion today, everybody. Just as far as RISE, and I believe the other one's Safe in Michigan, they do great things. If you don't already, follow them on Facebook. They put out, what they do is based on facts, and they put out some PSAs. So work with them. And if there's communication issues, yeah, the health department can also address that. But if I was a Otsego County Commissioner and I knew there's issues on that end, I would address it and go to school board meetings myself too, and or get with RISE and speak to them about it. Something else, I forgot it, but yeah, We can communicate on both ends. They do good things. Work with them.
Thank you, sir. Would anyone else like to address the Board of Health? Hearing none, we will close public comment. Commissioner comments. Mr. Van Alstine,
I'm good to go.
Ms. Levanway, Mr. Mapes, Mr. Aaron's,
All set.
Mr. Chamberlain,
Good to go.
Mr. Mason.
We seem to be growing a huge onion. And someday maybe we'll address peeling back the layers of the onion. That's it, Mr. Chairman.
Thank you, sir. Mr. Turnbull.
Just I hope everybody had a good Easter holiday and I've got nothing for the board.
Thank you. I have nothing further. I would take a motion to adjourn.
So moved.
I'll second.
Moved and seconded. All in favor, say aye. Aye. Any opposed? Have a great day. Thank you.
Man, I want to oppose it. Nobody ever opposes that one.
Mr. Van